Anyway, today we're going to be talking through how to prepare a successful patient experience network national awards, or PENNA Entry. At PICA, we've been working with PENNA for some years now. Very, very proud to support what we consider to be a fantastic initiative that showcases some of the best work in person-centered care and in measuring, improving and understanding patient experience. I'm delighted to be joined by Ruth Evans, the Managing Director at PEN. I'm going to start by handing over to Ruth to give an introduction to PEN and to the National Awards. Ruth, whenever you're ready.
Thank you. And welcome everyone. Thank you for joining us, and a huge thank you to our speakers and to the team at PICA for supporting this webinar today. We ran one last year, and as we've done the evaluation of our awards for last year, we have been hearing from the people who took part that how useful the video was and how useful hearing from our presenters was. So I'm hoping that you'll find this one useful today. I am Ruth Evans. I'm one of the founding directors of the Patient Experience Network. And we set ourselves up in 2010 to enable organisations to have the opportunity to put the spotlight on good practice. There's a lot of vehicles to focus on what is not working, but not necessarily the same opportunity to focus on what is working. And so we were very much looking at how can we put the spotlight on good practice, how can we celebrate that, how can we share that, and then through that process support organisations to embed and sustain for the longer term, and make sure that other organisations are taking on this good practice. So that's enough of who we are and why we set up, I think, but I should introduce Helen. Chris has already mentioned Helen. Helen, if you do take part or have taken part in the past, you'll know Helen because she's the one who does. And she's here today if you've got any questions about the details. Helen will be able to answer that, and if she can't, we'll take the query away and get back to you. Louise is someone else you may also have heard of or have corresponded with. Louise is not with us today, but I do have some notes from Louise, so she's with us in spirit. So the awards are an opportunity to put the spotlight, as we said, on good practice, and I'm delighted that you've joined us today to explore what that might look like. I thought I would share with you today our website. So if you've got any questions, your first port of call may well be our website. If it isn't, it may well be one of the team on the phones or Helen, but often people will go to our website. So if you haven't been, I thought I would just give you a little whistle-stop tour about our website so that if you've got any questions, you will have the opportunity to know where you might want to go. So here is our website. You just put in patientexperiencernetwork.org. We've learned that perhaps that should have been a shorter title, but that is what you have to type. But you only have to do it once because then it's in your in the memory. If you look across the top, you've got the awards tab. If you hit that and click on that, that starts to tell you everything you need to know about the 2023 awards. So it tells you the deadlines and it gives you the information. So you can see the information there around our timings and the event and all that kind of jazz. If you are thinking of entering and you're not familiar with our categories, you can click on our category listing and it will list the categories there. We like to think that there is something for everyone here. And if you are unsure about which category to enter or are thinking about several categories, then please get in touch because we can give you some guidance. The categories, there are 22 this year, and we took some feedback from various people, and we always review the categories just to look if there are better ways to reflect what's happening, what's current, what is making a difference in patient experience today, and make sure that our categories reflect that. So you'll see that there's a new category which actually came out of our audience last year around a patient contribution, because one of those light bulb moments, we didn't have a category. So we've got a new category and we've streamlined some of the other categories. If you're thinking about, well, what are the criteria, what are the guidelines, you can click on here. And this will download a document. So you just need to open that document and you can see it will share with you the marking guidelines and the criteria. A couple of points here. If you've entered before, we've reviewed these and refreshed them. It's not a radical rethink, so don't worry, but we have just tightened up on some of the areas. So, for example, it was called innovation before, but we've called it new thinking. It may be it's not totally innovative, but actually it's new thinking for your organization, for your department, or for the way that you're working with your patients and carers. So innovation felt too narrow, and we wanted it to be new thinking. We've really built up involvement and inclusion. It was always there. Patients, you heard from Chris, it's about person-centered care. And of course, patients have to be therefore at the centre, as do colleagues and other people. But we wanted to make sure that it was drawn out more specifically. So you can see that there is an involvement and inclusion specific criteria now, as opposed to being embedded. It's very explicit. And the other area that we have of it is new, and I'll just go back to our website here, is before we used to send you a resource to put together your submission, whereas now you can do that on our brand new portal. It's very exciting. And you just click on here. So if you're interested to take part, you just need to sign on to our portal, and then your submission is there for you to add to share, to get other people to contribute to until you're ready to submit. And at any point you can change it. And I'm going to be really honest, even after you've submitted it, you can change it. But it's slightly harder. We have to unsubmit it for you so that you can change it. But so it's there for you as a resource to go on. So it's like the document that you had before, but it's now available on a portal. So those are the changes. I'm going to hand back to Chris, because I think that is everything I wanted to cover. And I'm sure there'll be questions that Helen and I can answer later, but I'm going to stop sharing the website. The other thing I should just mention is there are categories down the side. So if you want to look at examples of good practice, the website has them split by category. So over to Chris.
Excellent. What a great introduction. Thank you, Ruth. So we're going to be joined today by a number of panelists who very kindly volunteered some time to help with the session today. I'm going to introduce each of our panelists in turn as we go through, and they're going to talk about their experience with the awards, whether that's as a judge or as a successful entrant, and we're hopefully going to learn from their experience. I'm going to take chair's privilege and go first and briefly talk you through the judging criteria that's used. Now, Ruth has already given an overview of the judging criteria that's in use this year. So I'm going to try to just add a perspective as a judge about how we employ that and how the scoring works and so on. Next slide, please. Of course, before I get into any of that, I am obliged as PECCA's CEO to tell you a little bit about our organisation. I mentioned we're a charity based in Oxford. We have a vision of the highest quality person-centred care for all, always. And we've always seen patient experience as being a measure of that quality of person-centredness. So measuring, understanding and improving patient experience has been at the heart of our work over the last 2 decades. That we were founded in the year 2000, and we've been working on this agenda ever since. For that reason, the work that PEN does and that's recognised via PENNA is really dear to us. The successful applicants, and in fact all of the applicants showcase some of the best work that there is out there around improving people's experiences of care. So we're always really pleased to be involved in that. And I'm particularly delighted when I see submissions that reflect the PECCA principles of person-centred care, which is presented on the right-hand side of the screen here. This is an internationally recognised quality framework that focuses on what matters most to most service users and families. This forms the foundation of our own measurement programmes and is a good way of thinking about where you might prioritise and where you might seek to create improvement for users. As Ruth mentioned, there are 5 judging areas that are used as part of the PENNA Awards. I've had the pleasure and the privilege of being on the judging panel for some years now. And the criteria are new thinking, leadership, outcomes and sustainability, involvement and inclusion, and transferability and dissemination. We're just going to go through each of those individually, but first a quick look at the scoring. Next slide, please. Thank you. The scoring guidance for judges is quite simple. For each entry, we'll assign a score from 0 to 100 for each of those 5 category areas. Now, the guidance for judges is that scores of 80 to 100 should be reserved for the most outstanding entries, those that provide compelling, robust descriptions with full evidence of how the criteria is met. And we'll give lower ratings where the evidence is less compelling or missing. So if you don't address one of the questions, you can expect to get a lower score. And thus, it's important to work through and make sure when you're submitting that you have covered each of the 5 areas that we're going to talk about. Next slide, please. The first of these is new thinking. And this is really about whether the initiative is different, innovative, and ambitious. As Ruth said, this doesn't need to be a grand, world-changing innovation. It can be something that's new to your organization, but it's about challenging things, challenging the way that things have always been done. It's about standing out from the crowd, and it's about solving problems in creative ways. So we want to see, as part of the evidence for this, how you've identified a problem, how you've worked through a solution to it, and how you've implemented a change that's addressed that. Fundamentally, I think what we're really looking for here is ideas that make you think, why hasn't this been done before? Because often those are the ones that are most easily spread and shared, and the ones that can be the most innovative. Next slide, thank you. The second criteria is leadership, and this is about the quality of management and project leadership that's part of an initiative. Now, that doesn't necessarily mean senior staff. We're not necessarily all that interested in whether the CEO has signed it off, but rather we recognise the leadership from all levels, including from patient and community representatives. We're looking as judges for initiatives that demonstrate clear objectives and problem solving that follow a path from identification of the problem through to creating a solution and testing it. We're looking for initiatives that are well planned and executed and that involve relevant stakeholders and communities. So good communication is really important here. We want to know how stakeholders have been brought along as part of the project. We're also really interested in continuous learning because we know that improvement is seldom linear. There can always be setbacks, and understanding how those have been dealt with and addressed is important. Next, please. Outcomes and sustainability. Now, fundamentally, we want to see initiatives that have been effective in improving people's experience and that have been properly assessed. So we want to see evidence of performance being tracked, but that doesn't necessarily have to mean quantitative tracking. We don't necessarily need reams of statistical data. We simply want evidence to tell the story of change and to demonstrate impact. It is particularly impact that we're most excited about. So as a judge, I'm more interested in things that show what difference a change is made rather than show that a change has happened. So outcomes and impact rather than processes and activities. And of course, the outcome measurement needs to speak to people's experiences specifically. This year, we also include sustainability as part of the outcomes category, and this is about being able to create long-lasting sustainable input. So there shouldn't be a need for superhuman effort or outlandish expenditure to maintain a project or initiative. It should be able to continue itself effectively. Next, please. This is a new category and one that's really critical to PENNA. Involvement and inclusion is about making sure that the work involves beneficiaries throughout and promotes inclusivity. So we're looking for initiatives that show involvement of patients, carers, families and staff, ideally from an early stage. And that involvement could be in different roles, including co-production, but also roles on steering groups. There are a range of ways this can be tackled. We certainly want to see inclusivity. And that should consider issues like accessibility, but also cultural factors, and should actively seek to hear from seldom heard groups. So people from Black, Asian, minority and ethnic communities, and similarly people from other communities who may less frequently be heard. We're also keen to see proposals that take a deliberate approach to understanding and reducing health inequalities within services or within communities. And we want to see these ideas spread and shared as well. The best thing is projects that can be replicated and where the impact can be diffused. So we want others to learn and improve together. And we're particularly excited to see projects that demonstrate the sharing of learning. Now, that sharing need not be complete. There can simply be a pathway to it. So having a communications plan to be able to share knowledge with others can be very exciting. And that's all I really want to say. Next slide, please. Those are the criteria, those are the marking scheme. And I think overall, my key message to you really is that what stands out most to us judges is cases where there's a very tangible sense of impact and a focus on person-centeredness. We want to live the values of these awards, so we want to be focusing on things that meaningfully and sustainably change people's experience and can be demonstrated to do so. I hope that helps. I'm going to hand over now to our next speaker. Ruth is going to talk a little bit about entry considerations.
Thank you, Chris. And I'm hoping that's really brought the criteria to life, because I think criteria can feel scary, but actually they're not. They're just a framework to help people understand what they're looking for. And to help you structure your submission. And on that point, entry considerations, this is where I chatted to Louise, because Louise, Helen and I have been running an evaluation. We usually do, I wouldn't say every year, but we usually do an evaluation. And that's where we get a chance to talk to people. And you're going to hear from some people today, but Louise was distilling what she's been hearing into things that set entries apart. And there are three key elements, and to some extent, Chris has touched on this. It's a passion. It's a passion for your project. And through that passion, you may get setbacks, but it's about the resilience. It's about your creativity and finding a way. It's the art of the possible often, because these are not new problems often, but they are problems that you have managed to tackle because of your commitment and passion. We've highlighted it extensively, but these are patient experience awards, and therefore it has to be with the involvement of people. Obviously, the involvement of patients, although it is funny, we say obviously, some submissions do neglect to mention how they involved their patients. We don't doubt that you did, but we can only go by what you submit. So make sure that you have referenced how you've involved patients, carers, family members, whoever it is that you are really focusing your experience improvement on. But often it may be staff as well, colleagues, and other stakeholders, other third parties maybe. So involvement is key. And then Chris has really mentioned this, but it is around the impact. What was your end in mind and what difference have you made? And sometimes you have unintended consequences. We've heard of programs that through their action have improved staff retention. That's a really interesting outcome that may not have been your intention. But if that was an unintended consequence that you observed, there was one where it had an unintended consequence of reducing the number of falls. Really interesting. If you can change the environment, improve the patient experience and have the consequence of fewer falls, fewer outbreaks of aggressive behavior. These are really interesting things because they have ramifications and ripple effects really widely, including staff retention, mortality, really, really key things. So down to three, what makes them stand out? Passion, involvement, and impact. And making sure that you've captured that in your submission. That's all I wanted to say for now. Back to you.
Lovely, thank you, Ruth. We're now going to go to each of our panelists in turn, and we're going to start with Azmina Rose. Azmina is the lead for Cancer Patient Experience in the Macmillan Information Support Centre at the Royal Free London NHS Foundation Trust. Azmina, I think, was a first-time entrant in 2022, but also a category winner for the project Let's Talk. Azmina, over to you.
Thank you very much. I have unmuted my mic, so I really hope that means that you can all hear me. And next slide, please. So this is a picture of myself and my dear colleague, Kerry, winning the Cancer Patient Experience of Care Award at last September's wonderful ceremony. for everyone who does end up entering. The ceremony is something that makes you feel very special, even if you don't end up being a winner. So I really do have to praise and commend the experience of that ceremony, that lovely event in Birmingham. Next slide, please. So the keys that we think were the elements, sorry, that we think were that led to success for us with our entry, which was the Let's Talk Cancer program of improvement, were read the judging criteria very quickly. Very carefully. As Chris and Ruth have already said, for anyone who's entered the awards previously, there have been some changes this year. So do make sure that you really think about those when you are preparing your entry. Ruth has already alluded to this when she reminded everybody to make sure that we really spell out the patient and family and carer involvement. And so what I would say is always remember that the judges don't know anything about your project. This might sound really obvious, but when you're somebody like me who was literally living and breathing the project for the 3 years before I filled in that entry form, it can be really a discipline upon ourselves to remember to go back to basics for the judges. The other thing I would say is be honest about any criteria that you know in your heart of hearts that your project might be a little bit weaker on. So, for example, when we were doing our project, we did a lot of it during the pandemic. And what that meant for us here at the Royal Free Hospital is that we were following like all of the social distancing guidelines very carefully, unlike our friends in Downing Street. And so what that meant for us is that we could only gather our patients and carers by electronic means. So we had to use Zoom for our focus groups. And what that meant is that unintentionally, we were guilty of digital exclusion, because normally the patients who didn't have access to the internet, we would have got them in this room and we would have sat them down with a cup of tea. But at that time, we were only allowed 2 people in this room, and we had to keep those people 3 foot apart. So be honest about anything that you think you would have done differently, because that's really important, because we mustn't ever be afraid of like critical thinking and self-reflection. As much as we really want to impress the judges with our work, we want to also be honest about our projects. And finally, my last tip is don't rush and allow plenty of time. You've already heard the deadline isn't until the 14th of July, so you've still got plenty of time to get this right and do yourselves justice. So final slide, please. I just wanted to say that based on our experience here at the Royal Free, practice makes perfect. You've heard that now you can practice your entry form actually in the portal. And please don't pay too much attention to this busy slide. I just wanted to highlight that for every sentence I wrote, I made sure that I linked it to a particular criteria that we were being judged on. So you'll see that in my practice version, I have the word innovative in bold. Last year's criteria was innovative. You've already heard that this year it's been renamed new thinking. But really link all of your thoughts and to the specific criteria as much as you can. So that's all I wanted to say. So you can finish my slides now. And for those of you that are thinking of entering, very best of luck. And I will be keeping my fingers crossed for you. So thank you very much for having me today.
Thank you. That's wonderful advice and brilliantly timed as well, I must say. We'll move on now to our next panelist, Jonathan Wright. Jonathan's the head of patient access at University Hospitals Dorset NHS Foundation Trust. I think Jonathan was involved in a collaborative project last year, which I believe won not one, not two, but three categories. So an excellent speaker to have with us today. Jonathan, over to you.
Thanks, Chris, and thanks, Ruth. Just checking you can hear me. Perfect.
Yeah,
Thank you. So yeah, thanks for the invite. And I'm going to just talk through our journey in creating a winning entry. And it was amazing to win 3 awards last year. So thank you. Next slide, please. So I think it's really important to say, as Mina did it, we were extremely proud to pick up those 3 as a Dorset system. And as you can see there, three awards around partnership and integration. It was a huge boost to winning those for everybody involved, because it kept momentum going, because it was during a difficult time around post-COVID, and actually the outputs of winning those have been just as important as putting our project and application together. The recognition and the success again has also had that positive impact on our patients, our staff, and our volunteers with our project. I thought it'd be helpful just to let you know that a bit about what our winning entry was, and it links back to as Mina's points around the why, the what, the how. We lived and breathed the project too, and it's so easy either in the application or presenting to forget what it was all about. So the why really around the risks associated with our elective waiting lists and waiting times growing, and the impact to patients and staff of that due to the COVID pandemic. The what, so creating a high flow assessment clinic, one of them was in a local shopping centre, second floor department store in a pool shopping centre, and the how, just that collaboration and partnership with patients and other key stakeholders from the start, co-designing our facility and redefining it with patients and clinicians and other staff. Just a little bit rooted it around ambition and resilience, really important to get those across in entries and the challenges that we have. And I think to summarize it, it's making sure you've got your elevator pitch right in the application form about what it is. Thank you. Next slide. Lovely. So around being ambitious, initially, and we've heard a little bit about it, you jump into one, but it's worth just assessing against all the potential categories and the criteria and looking at which one or several you could enter. Understanding the timelines and the process, as we heard already, don't rush. Try and give yourself as much time as possible, because actually with the tight word count, with involving the key stakeholders, it really is just refining that submission that takes the time and getting the keywords in there that you really want to, and the key message to get across. We had a small team, although there was a big team for the project, but a small team around our submissions for awards. Definitely having expertise around bid writing, so that there may be somebody in trusts already that you could tap into who's used to tight word counts, but also having the expertise around what was done and the outcomes, etc. Thinking about, and we've heard from Chris about the information to demonstrate impact. I think really important, and it is possible to for most things to put in. We thought we would do this. This is what we had as an outcome and some quantitative data, but also really important to have that qualitative impact from patients and staff, which is what we did. As I mentioned earlier, be so clear about the why, the how, and the who, and the what, because it is so easy, as Mina said, to not get that message across. And I remember when I was doing my presentations at the awards, it was just remembering to always go back to what we were doing there. So I can't stress that enough to make it clear and what you hope the outcomes would be. Thinking about maximising the supporting information, where possible, always have images, graphs, videos, etc., that can hopefully go along with entries. We had a number of videos that we we created for different purposes, and put the links through to those. Thinking about bringing it back to the people. So from the beginning, we were very clear around the ambitions for patients, for staff, and bringing it back to what we had intended to do for them. Had we achieved it, and if so, how and what were the benefits? So again, just remembering and be explicit about why you're doing it and who it's for. And then thinking about the future. So how has the project informed new ways of working? How do we take some of our innovation back to other sites within our organisation and other things? Talking about the challenges and how we overcome them, which again, as Mina talked about, but also what's next? What are the ambitions going forwards from the learning is also key to, because none of these things are a one-off project that stops as soon as you've finished it. So they're the key things that I wanted to bring up. I'm always happy for anyone to contact me. I haven't put my contact details in here, but I'm sure that can be arranged. So last slide, please. And again, I just want to say good luck to everyone. It was a great experience, the whole process, if I'm honest. And I didn't have any expectations about the awards ceremony as that was the first time. So it was great to be there. And thanks to everyone. Thank you.
Fabulous. Thank you very much, Jonathan. Much appreciated. We have another panelist up now. Next is Grace Alec. The Reverend Grace Alec. Grace is the chaplain at Barking-Havering in Redbridge University Hospitals NHS Trust, and has been a winner in 2022 for their DAISY project, which I believe has also been a winner in 2017 and entrant in 2016. So one that really demonstrates sustainability and long-term impact. Grace, over to you.
Hi, yes, and thank you for having me here today. So our DAISY project was the winner. We actually entered the DAISY Volunteer Project for 4 awards, and that's something that I would like to stress, because I know, being one of the last panelists, you've heard some of the points that I'm going to raise, so I can whisk through some of those. But it is important to recognise that there are times where your project might cover more than one thing, and so in those situations, really have a chat. I spent a lot of time on the phone. I think it was to Helen. But yeah, just talking through where might be the best fit for the project in terms of which category to enter it from. We actually entered it for 4. We were finalists for partnership working to improving the experience. We were also finalists for strengthening the foundation, and then we were runner-up for support for caregivers, families and friends, and we actually won the category for personalisation of care. As a trust, Barking-Havering Redbridge, we've won PENNA Awards in 2017 for work we did around bereavement support, but that was more in terms of our support for those who are wanting to view deceased relatives. And so we worked around changing our viewing department, and so we were able to be quite successful in that application in 2017, and that's where you would have seen the previous one. So just running through the slides now, if we can go to the next slide, please, that would be great. Apologies for the phone ringing at the moment as well. So as you can see, that's the team. We managed to take some DAISY volunteers up with us at the time. I'd just like to talk you through some of the things, next slide please, that were really important for me in terms of making the event application successful. I spent a lot of time on the website, so I know that's been mentioned before, so we can go through some of these slides. Literally just looking through all of the information, reading and rereading the judging criteria and what the expectation was. Next slide please as well. And again, spending time over those points in terms of the marking criteria, knowing that I wanted to at least come in at adequate, so making sure that all the points were above average and lots of evidence. For our project, we worked in partnership with Mary Curie, so we actually had a lot of KPIs that we had already collated throughout the project, which meant that we could use that evidence in terms of the application that we made and how that worked. So that worked really well in providing that information that we could then add in. And as I think it's Jonathan that just said, it's really useful to be able to add in additional videos. We had our DAISY volunteers so that their voice could come along as well. It wasn't just an application, but you had the volunteers speaking. Next slide, please. I also looked at the previous entries, so I know our own trust had some entries in the past, but then looking at previous entries for similar categories so that I could see what had been successful in the past, looked at some of their runner-up ones as well to kind of distinguish what they're really looking for in terms of our application. Next slide, please. Again, YouTube, I'm quite a visual learner, so I was looking not just at ours, that's our experience at PENNA 2022, the pictures on YouTube, which was great, thank you very much, but the other presentations, there's loads of presentations and information just so you can really get a feel of what they are looking for in terms of the application. Next slide, please. And looking through some of the winning applications in other areas as well. Next slide, please. When it came to the application form, one of the things that really stood out in the information is making sure you use your full word count. Next slide, please. There are lots of opportunities, and so I just made sure I maximised the word count on my application. And the other thing, which is what, as Mina mentioned as well, putting in bold some of the things that you want to stand out that are literally linked to the keywords that the judges are looking for. I believe, I think Ruth can correct me if I'm wrong, there are different judges for different categories. So if you enter more than one category, don't think, oh, if that judge won't pick it for another one, because there are different judges. And so, you know, I was able to use that application, adapt it slightly so the focus was on the right things for each category. If we can whiz through to the last slide, because most of the other things have been said. Again, just be key on your points that you want to get across, the key winning points that you want to get across. And we also got patient feedback in. So I would say use the resources available, clearly communicate the impact that you had, use your word count and call PEN for advice. I think Helen was on speed dial for me. Thank you very much for your time.
Thank you, Grace. That's really fantastic advice and you know, really good summary of it as well. I'm sure people have found that valuable. We're on to our final, but by no means least panelist now, Nikant Alawadi. Nikant is the Director of Patient Experience and Insight at Barts Health NHS Trust, England's largest acute provider. He's also one of the judges for the Patient Experience Network's National Awards, and will be telling us a bit about what he's looking for as a judge. Nikant, over to you.
Thank you, Chris. I think a lot of the points that I was going to make have already been covered by others, but I'll still try and not repeat too much, but I'll still try and go through the things that I wanted to. The first one for me, when I'm looking at a potential entry, is the basic question: is it a new idea, or is it a new take on an existing idea? Because remember that not everything needs to be new. We need to shamelessly learn and adapt from each other's ideas, so we should never be scared to do that. But is it a pressing problem that you were trying to solve? You could have taken an idea that happened elsewhere, but used it creatively. So that's an important one for me. I'm not saying that it happens in the PEN Awards, but I've seen it elsewhere where we sometimes have a solution that is chasing a problem it can be applied to. So that is not something we should always start with the problem, then think of, is that a clever solution to it, or well, I've got this clever idea, where can I go and implement it? So maybe start with the problem. Which part of that is then also thinking, what's it targeted at? Because the conventional wisdom would obviously suggest that you should cast your net really wide, but it also means that by doing that, there are niche patient groups that can be left out. So not every idea will solve huge problems for everybody. It might solve a big problem for a small group. So that's important as well when thinking about the scale of the impact. Another thing that I would look for in an entry is who was involved in the design. How inclusive were you? You know, if possible, was the community involved as well, as opposed to just the patients? Because quite often we are seeing in different trusts that patient experience and engagement sit very, very closely and go hand in hand. As Chris mentioned, I'm the Director of Patient Experience and Insight at Barts Health, but I'm also on the board as an associate non-exec director at University Hospitals in Derby and Burton. So that's something that I'm pushing there as well, is to make sure that we're thinking of engagement and experience as two sides of the coin. The other bit also is in thinking about the impact. What next? What happens with this? How will you measure the impact? How will this project continue after that honeymoon period is over? You've got bored with it and you moved on to the next shiny thing. Is it a short-term thing, or have you thought with this project in the long term? Because it's not just about going and doing something now. Does it have a life to continue after the initial award and excitement is over? Because it's about making sure that it's a sustainable thing. Be honest. I would say in your entry, don't exaggerate the impact, even though you might be tempted to, because the judges are looking for these and 2 or 3 things. Let me exaggerate those. That doesn't work, because we're all working within patient experience. We can see through some of these things. I think be very honest. As I mentioned earlier, that not every idea will change the whole world, but it might make a huge difference to someone's world. So that is really important, that while scale is important, the impact that it can have, meaningful impact, is much more important for me. And that honesty sometimes, and the challenges that you face while trying to do this is also important. At the end of the day, it's not a Hollywood movie where you're the hero and everything works out well in the end. I'm sure you face challenges. So that is really important for us to hear as well, about how you overcame those challenges, and some which you maybe haven't managed to overcome, but you're still persevering on those. And I think connected with that, I would say that ambition and passion are probably as important, if not more important, than scale. And that sometimes when you read something, you can really see that coming through in an application, and how passionate you are about the topic. And you can sometimes fake the scale, but you can't fake the passion. So that's really important. And the last one for me would be engaging. We spoke about 4 or 5 different criteria that I look for as a judge, but do you still have my attention after having covered those 5 or 6 points, or am I already bored by this point? And connected with that, I would say that if there were paragraphs that while reading, I'm just skipping through, why bother putting them in? If they don't add to the story, if they don't add to the narrative, then maybe they're just there for the sake of being there. So just skip those, make it short and punchy. And related and connected with that engaging point is, can I relate to the topic? It might not have impacted me personally as a judge, but have you made it relatable to me in a way I think, oh, that's really nice. I wish my team had thought of that. And I want to go and share that with the team and say, there's a really good idea that's, John or Paula have come up with. Can you go talk to them and find out how they did it? Maybe we can steal this with pride. So how do you make it engaging and interesting for me as a judge to sit through, if I'm going to be sitting through 20, 30 applications? Have you got my attention till the end of that? And I think the last thing I will say is on that is, like, really good luck with your application. And I look forward to reading about all the projects. And as I keep saying, shamelessly stealing and learning from those, because that's what we all need to do, is rather than reinventing things, is learn from each other. So good luck with your
Nikhan, thank you so much. That's really, really helpful, and really rounds out our panel presentations very nicely. We've got about 15 minutes, a little less left now for questions and to round up. If you have any questions that you'd like to raise for the panelists, please do stick them in the Q&A or in the chat. We'll try to cover those. I'm aware that we've had quite a few that have been dealt with already in the chat, especially by Helen and Ruth. So thank you very much for that. Just to get us started, though, we've had some pre-submitted questions. Ruth, one for you to begin with, and you touched on this in your presentation at the start. You mentioned there are 22 categories. That gives people a lot to choose from. Do people have to decide in advance? Is there any help for them in doing that? And can people submit to multiple categories?
So 22 does sound like a lot, but when you look at them, they do cover the whole range. So they go from the very big, the strengthening the foundations, to the very specific, to perhaps looking at student advocates. So So the quick answer is you do not have to decide right at the beginning. And sometimes as you're writing it, it becomes clearer what it is. If you simply don't know or you want some guidance, I think you've heard that we're here to help, particularly Helen, who's really she's very experienced on translating what she's hearing into matching that into a category. But we also have the team with Michelle and Sarah who can give you some early advice as well. And if you are entering more than one category, because it may be that actually it does actually look like it fits into a couple of categories, I would really recommend that you tailor the submission. You don't just cut and paste the submission. And you heard that very much from Grace, I think, and to some extent from Jonathan. The submissions, the categories are different. And if you're doing a simple cut and paste, you may not be giving yourself the best opportunity to match what is key for that category. However, it could be that actually you've written such a random submission that it's only a couple of tweaks that you need to do to make it relevant. I hope that answers the question.
It does. Thank you very much, Ruth. Next question. And this one, I think, for all winners, Asmina, Jonathan, and Grace. Could you tell us a bit about how winning has impacted you in your project? What changed as a consequence of winning?
I'm happy to go first.
Thank you.
I think I touched on it really. It was quite a morale booster for everyone. So we talk about project. So we did the piece of work for a specific reason because we had a challenge. The celebrating and sharing good practice is a bonus, isn't it? Really, and I think the outcome of going back to the organisation and to the system of saying we not only won one award but we won 3. That's really boosted everybody to want to keep the project going, and in fact it has. And I think the importance of our co-design with patients and that being recognised, and I probably didn't say around our community as well, but taking the back, saying we're doing the right thing does really help. So it allows us to do that, but also us thinking about, are we celebrating our ideas enough, and are we rolling them out further in other areas too? So that would be my points. Thanks.
Thanks, Jonathan.
Thank you. I'll just add next. I think for us, our project was funded initially by Marie Curie. So even just having those that recognition really helped in terms of the trust buy-in as well, of seeing the impact, and actually now that being a role that's fully funded by our trust and has been able to continue. So we have a paid volunteer coordinator, so it's just one position that's paid, and then our team of volunteers, we now have about 33, and they are volunteers, but the paid role coordinates them. So just in terms of funding for us, it's made a great difference.
Thank you, Asmina.
And for us, we wanted to share our work with other trusts, and having the profile of the win just led to more interest in that. So we had already shared it for free with some other trusts in London, but after the win, more people got in touch, and that was really what we wanted. Just, we'd done the work, and there's no point if we just have local benefit for our work. We wanted all cancer patients everywhere. So PENNA really helped us to kind of achieve more of that ambition.
That's brilliant. So I'm really hearing a strong message there about how success has led to greater buy-in locally, improved sustainability, and helped with spreading and scaling, which is fantastic. It's what the awards are all about, I think. If I can move to Nikant and ask you a question as a judge, and perhaps one for Ruth as well. Is there anything that you see regularly overlooked in submissions? Is there anything that's often missing that you wish was there?
Did you say category or criteria?
Oh, in terms of entries, is there anything that goes into an entry, regardless of the category, that you sometimes see omitted? It might be a feature that's particular to a category, or might be some kind of information that you want to see but don't.
I think for me, a picture can replace 1,000 words. So if you've got an event, or you did an engagement thing, just put some pictures in there. Just make it a bit more engaging, I would say. But equally, I would say not just what is missing, but what is there that doesn't need to be there. As I said earlier, if you're putting stuff there just for the sake of making it in a padding, we don't need that. We don't need filibusters. This isn't the US Congress. So you don't need to have that stuff in there. Just if there's anything that you think it's not, is it adding value? If not, get rid of it and make it short to the point, unlike my explanation. And then it just makes it that much more readable and enjoyable for people. And I'm like, oh, that's really interesting. I can pass it on to somebody else can quickly read the summary, understand what it is. They might contact you to get more ideas from you. And then it starts the whole sharing of circle with that.
Yeah, that's brilliant. Thank you. And I love that message that more is not always more in the case of these. It's really about being to the point and making sure that you're presenting yourself as well as possible. I think it's important to say that judges often have a reasonably large number of entries to read. So standing out is about kind of clarity and precision and making sure you hit those points well. There's a couple of questions in the chat about funding, and Ruth, I wondered whether you just wanted to say a little bit more about you know, how entry fees work and about funded categories and how funds are used.
Yes, I'm just going to add to Nicolan's comment around the word count. Helen's going to put me right if I've got this wrong, but I think the first section about your organisation is not included in the word count. So, you know, it does help people to understand your organisation, the context. That's not included in your word count. So, and we're talking word count. It doesn't cut you off at the knees at 2,000, but you do need to remember that there's a judge reading this at the end of the day. So, in terms of the entry fees, we say it's a nominal fee, but I absolutely understand, and Louise, you've captured it. Nominal to one trust is not nominal to another, and it's very, very tricky times at the moment. But the fees are there to cover the cost of entering and the whole of the cost, and then included in that fee is attending on the day. There are a couple of categories that have got some funding that means that they are free to enter. Well, it's the Fiona Littledale, the student categories, and the cancer experience of care. We are looking at potentially finding funding for others, but it's difficult all round, but those are the ones at the moment. What I think is quite interesting is we heard from both Asmina and Grace to some extent, and I think Jonathan actually, which is once you've made this relatively small, but I understand it's not instant, you know, it's still something that you have to find. The benefits that you get, there's no team event that you could run for this kind of fee. And yet the team impact, the morale, the motivation, simply from entering and recognizing you've put together something really cool. The additional funding that you get, the learning and sharing that other organizations can get that then might impact their own funding. These are hidden benefits, but they are, it's the benefit of taking part. If you've got any other questions, just let us know. We can invoice or we can take by PayPal, Helen. I'm gonna wade into stuff I don't really know about, but I'm pretty sure we can take credit card payments. Any way that you want to pay us will work away. Don't talk to our accounts team about that. Talk to Helen, because their answer will be no. But we will find a way to get you involved. Again, I'm hoping I have answered that question properly.
You have, Ruth, and I'd endorse that. I think it's fantastic value, and you know, attendance at the events is such a valuable experience for people, as we've heard from some of our panelists. Grace, you've got your hand up.
Yeah, I just wanted to come in there as well because, you know, as we were able to enter additional, it meant we had extra places for the awards, and I would really recommend to people, you know, even if you aren't successful, using that place, because just to be there and to see the other projects presented and all the things that are happening at the awards, we were, like I said, able to bring some of our volunteers just to get that experience on the day. It's just a brilliant opportunity to come together, network and hear more things. So that is included in the fee as well. And then there is an option for additional tickets later on as well. So I just take up those opportunities.
Thank you, Grace. Yeah, again, I completely endorse that. I think it's a really inspiring event to attend that and be part of. I'm going to start wrapping up now because I'm conscious of time. I'm going to hand over to Ruth in a minute just to give a final sum up. But just to first of all, say a huge thank you to all of our panelists for taking time to share their stories and their feedback with us today. A huge thank you to all of our attendees for spending the time with us this afternoon. We really hope you found it valuable. To try the best I can to draw together some key messages from all of that. I think the things that have stood out to me are about the wealth of information that's there to help you. So Grace talked about the resources, the past entries, the videos, the YouTube content that you can refer back to. I can't think of any other sort of event that has that much information that will help to guide you. It's a really tremendous resource, and it's all there on the PENNA website. On the application itself, as Mina talked about, not assuming that the judges know anything about your application, so telling the full story, I think, is such an important message, and setting the scene appropriately. Don't forget that that initial section about your organisation is not part of the word count. And Jonathan, I thought, gave a fantastic account about how you tell a clear story. So making sure you get the who, what, when, where, and why of your story, and very, very clearly to let people know what the problem was, how you solved it, what worked, and what you learned along the way. That's a really great way to show the impact of what you've done. Now, the evidence for that, doesn't have to be reams of data. We heard about how qualitative data can be powerful as a part of that as well, and stories can be really persuasive. And finally, Nikant talked about how no project is too big or small. Don't feel like your project doesn't qualify because it's a particular service or a particular department or anything like that. That's the beauty of these awards. They give the opportunity to celebrate great practice in a range of systems and settings and sectors. And I'm really keen to see diversity in the applications that are received. I think that's all I want to say. Ruth, I'll hand over to you to briefly wrap up.
Final comments are, I think, if you are considering entering, we've talked about giving yourself time. It is actually a very, very simple. It is 10 question areas. It's normally things that you've thought about before. If you haven't thought about it, it should add to your project, because these are areas that you should be adding to your thinking. So I just wanted to say there is still time. There's still 3 weeks. And we know that some organisations do bring together the whole team, and together in a couple of hours sit down and have a great working session and complete the form. So the choice is yours, but we'd love to hear from you.
Thanks, Ruth. And yes, I should have said the deadline for submissions is the 14th of July. All of the information's on the website. Shortlists will be announced on the 7th of August, and the actual awards day will be the 28th of September. I really hope to see some of you there. And I really hope this session will have helped you on the way to that awards ceremony. So thank you all very much. We'll wrap up there. Enjoy the rest of your day. Please do get in contact if there's anything that we can assist you with. Thank you. Bye for now.
Thank you, everyone.